Welcome to the non-surgical hip replacement class. I'm Dr. Noah Volz. I'm a chiropractor in Ashland, Oregon, and I'm really excited to share this approach with you. So this is really for people who have been told they need hip surgery and don't really want to go through the surgery. So this approach has been developed to help those people and give them an alternative, and it's wildly effective. So, this class is designed to teach you about this approach and help you decide if it is appropriate for you and something that you would like to invest in so that you can finally get back to the things that you love. Whether that's hiking or gardening or riding your bike, hip pain can really limit your options. And so this program has been designed to get you back to doing the things that you love. So, what if you could avoid hip replacement surgery? That's really the essence of what I'm going to be teaching here, the essence of this treatment plan, and just giving you some alternatives to hip surgery, and going into depth about a technology that's been used in Europe for the last 50 years, but is now just finding its way to the United States. Called Shockwave therapy. And we'll talk about some of the success stories that I've had working with people with chronic hip pain using this approach. And then I'll give you the 8-week roadmap. I'll show you exactly what you can expect in terms of this treatment, so that you can make an informed decision about whether this approach is right for you or something that you want to try. So a little bit about me. My name is Dr. Volz. I'm a chiropractor. I've been in the healing arts for over 20 years. And I really take kind of an integrative whole person approach. Most of the work that I do is evidence-based or evidence-informed, but I really like to look at the whole person and come up with a treatment plan that helps them on all levels. I graduated from Life West Chiropractic College. I am a fellow of the International Association of Functional Neurology, and I'm also trained in the grip approach. And that is what this class, this treatment, this 8-week program is based off of. So I'll talk more about what that program is and how it can be used to help those of us who have hip pain. So let's look at some of the details about hip surgery. So in the US, there is close to 500,000 total hip replacements that take place every year. And most of those go relatively well. 95% of the people who go through a hip replacement report significant relief. They have an improvement in the use of their hip. It's only about 2 to 5% that have any sort of serious complications that occur, and 0.3 to 0.7% don't make it out of surgery. Some of them are at a higher risk for fracture, about 1%. And in terms of replacements, the hip replacement has a relatively quick recovery time. It can be 1 to 3 days of immobilization, either inpatient or outpatient, and there's significant improvement early on. Most people are able to do most of the things they want to do after 2 to 3 months. And most people have a full recovery from the surgery, and with that significant improvement in pain reduction and function after 6 to 12 months. So, for many people, this is a great option for them. So, what we're looking for in terms of inclusion criteria to help people is these different things. So, really, I'm looking for people who have chronic hip pain. They've been to the chiropractor, they've been to the physical therapist, they've been to the massage therapist, and they might have gotten some minimal improvement, but they haven't gotten significant improvement. Their hip still bothers them, and so they've gotten X-rays of their hip, and there is some osteoarthritis of the hip. There's a grading scale that I use to determine the grade of hip osteoarthritis. Your radiology report, your radiologist, your orthopedic physician, they're not really going to talk about this grading scale. They're going to tell you, it's bone on bone or severe arthritis, something like that. But I use a very specific grading scale where I can systematically grade the hip. And it goes from grade 0, where there's basically no problems with the hip, to grade 4, where there's really severe arthritis, sclerosis, joint space narrowing, some deformation of the actual bone that goes into the hip socket. Um, yeah, grade 4 can be bad. And so this approach works best for people who have grade 1 through 3 osteoarthritis of the hip. It also works really well for people who have labral tears. It works well for people who just have a chronically stiff hip that nothing else has seemed to help. It works well for bursitis, for impingement, femoral acetabular impingement, and for the trochanteric pain syndromes. So a lot of these don't have great treatments available. So this is exciting to give people a really effective treatment to things that often don't respond well to the current modalities that are out there. So these are the current modalities that have been used for hip pain for quite a while. Like I said earlier, this is an evidence-based program. I'll go through some of the research that really supports this program. But pain medication, that's probably the most common one, either over-the-counter non-steroidal anti-inflammatories or, prescription pain medication to get you out of pain and help you to live your life. The next step for most people is either physical therapy or cortisone injections. And sometimes these work really well. Sometimes you can get a year of pain relief with a cortisone injection at certain doses. That cortisone injection can damage the cartilage, so you are setting yourself up for future problems. But that year of pain relief for a lot of people is totally worth it. Some people, their doctor just recommends to wait and see if it goes away. And that can happen. But if it's really chronic, if it's been there, for years, it's unlikely that it's just going to kind of go away on its own. Physical therapy has helped a lot of people. If it's not a chronic, complicated condition, physical therapy or chiropractic or massage is completely adequate to get you out of hip pain. But if you've tried all those and they haven't worked, then you need a different solution. So that's why this approach has been developed, the non-surgical hip replacement approach. And it's an 8-week program. It's really systematic, comprehensive, personalized. aimed at helping you fully recover from your hip pain. And it's had great results with the people that I've used this with so far. I'll share some of those success stories. But they have completely avoided surgery. And it's happened in this 8-week time frame, which is less time than a hip surgery. And they've been able to return to the activities they love. And one of the things that I've seen with hip surgery, and this is just anecdotal evidence, is oftentimes you get one hip replaced, then you get the other hip replaced, then you get the knee replaced, then you get the other knee replaced. It does seem like getting your hip replaced does predispose you towards having problems in the other joints. And so this particular program, the 8-week program, doesn't do that. It basically gets the hip functioning correctly. There's no compensation that has to happen in the other joints because you now have an artificial hip. So that's why I really, really think this program is so helpful for so many people. So why choose this program? Well, the analogy that I often use is, let's say you've got a little backyard, and you've got two options. You can either put some AstroTurf back there, something synthetic, or you can, keep it natural. And then you do nothing to this yard for 10 years, no upkeep at all. And then after 10 years, you go back there and you need to refresh the yard and make it better. Which is going to be easier to do, the natural, organic yard or the AstroTurf? And in my opinion, using the natural elements is always better because they have a natural regenerative capacity. With this yard analogy, I mean, you can go back there and you can do some, heavy lifting, some hard manual labor, and you can pretty much get that yard back to a really good state. But the AstroTurf, it's synthetic. There's no way that it can regenerate itself naturally. And so really your only option is to replace that. And so you can get in a cycle of just replacing things with non-natural synthetic components that don't have a self-healing capacity. And I believe that this program is faster than surgery. So, an 8-week commitment, sometimes it can take 2 to 3 rounds of that in more severe cases. But for most people, say 90% of the people that we work with, they get faster results. And it's long-term results. It's not just a temporary fix like some of the other options that are out there. Even though the numbers are relatively small in terms of the complications of surgery, if you're in that 5% that doesn't have an improvement in hip function, improvement in pain, or even those who, don't make it out of surgery, that's significant. So it's important to be aware of that risk. And every intervention has some risks, but in terms of the risk profile, this is much safer than surgery. And it's personalized, customized. It's a very systematic approach. We're measuring everything from day one, and we're looking at those functional improvements as you go through the program, ensuring that you're getting the results that we anticipate that you should get. And this is all based on the work of Dr. Benjamin Fergus. He's in the Chicago area, and he has developed and designed the GRIP approach, which is Global Rehabilitation and Injury Prevention approach. He works with a lot of chronic, complicated cases and athletes. This approach has been translated into 7 different languages. And not only is it a treatment approach, it's also a training approach. and it's very comprehensive and systematic. And so that is kind of the foundation on which this program was developed. I've received training with Dr. Fergus starting back in it was 2016, 2017. I've continued to train with him, and I'm excited to offer this approach to the Rogue Valley, Ashland, Oregon, and to share these amazing results with this community. So the non-surgical hip replacement approach happens in 3 steps. It's a 3-step process. So the first step is assessing the hip. We're going to do orthopedic tests, neurological tests, functional range of motion tests. Also, if you have labs, I like to look at the labs, especially if you have an RA factor or a C-reactive protein, to see the level of inflammation in the joints that we're working with. And those X-rays can be really important, so I can, grade the hip. We can grade the hip with the orthopedic tests and determine that, but it's always great if we have those X-rays so we can really see what we're working with. And like I said, if you have grade 4 osteoarthritis, this might not be appropriate for you. I'll cover this at the end, but if you have the X-rays, we can set up a 15-minute free consultation, and I can go over those X-rays, and we can, talk about your options and determine if this would be appropriate for you. So I can help you kind of grade those X-rays, since that's not common practice in the medical mainstream at the moment. And then there's treatment. The treatment is chiropractic adjustments, high velocity adjustments, mobilizations, manipulations, the shockwave therapy to the tendons, the ligaments, the joint capsule, the cartilage, the muscles, all of the areas of the hip that have shown dysfunction from the functional range of motion testing. And then it's actually not strengthening that we're doing. I need to revise this slide. We're mostly using the global reset strategies to change the motor control pattern. So one of the things that I notice is oftentimes the way that you walk or the way that you move when you have hip pain will change. And so we call this motor control. The way that you're controlling the muscles changes. And we need to reset that so that when you walk or do things or move, you're not continuously aggravating the hip. So those are the global reset strategies. We get you to move in a new way without those compensations, so you're not putting pressure on the hip like you used to. So I have never come across anything like this in the Rogue Valley. There's nothing that combines the advanced technology, the hands-on care, the customized global reset strategies and exercises. It really is more comprehensive than anything that I have ever seen in this area. And so I'm really excited that so many people are getting benefit from this comprehensive program. It's also informed by the evidence. I looked at all the research studies, compiled those, looked those together, and really took the best of what's out there to develop this program and make it available for people. And I have been as I said, I've been in the healing arts for, over 20 years now. And so I have a lot of experience seeing a lot of different complications, different scenarios, and problem solving those and ensuring that you get the results that you anticipate. And so it's all, in one place. A lot of people who are, treating this are going to their physical therapist and their massage therapist and their chiropractor and their orthopedic physician. They're bouncing all over the place, but you can just come to one place and get the entire program just in one place and get exceptional results. So that's all. These are all things that I'm really excited about. So let's talk a little bit about the advanced regenerative therapy. So in the office, we have a radial shockwave machine. You can look that up. You can do your own research around that. As I said, this is technology that's been used in Europe for a really long time, and now it's just starting to find its way into the US. There's only a couple clinics that I'm aware of in the Rogue Valley that utilize this regenerative therapy, and none of them, as far as I'm aware, are doing it in the particular way that I'm doing it, working on the specific structures for a specific result with a really comprehensive assessment so that we can track the progress and improvement of these areas of the body. But the shockwave therapy has been used for chronic pain and dysfunction in muscles, tendons, and most of the superficial tissues for a really long time. And the research really shows how excellent it is. We'll talk about some of those studies. So I personally don't fully understand the science behind the shockwave therapy. It's pretty complicated, and I think we're going to need some more research to fully understand what exactly it is doing. But we can really clearly see the benefits of it, and there's a very few contraindications or problems. It can be a little uncomfortable. It's kind of like if you ever had ultrasound. So ultrasound is basically a heat wave. So it sends a wave of heat through the tissues, and that promotes a healing response. And the shock wave is sending an acoustic wave. That acoustic wave goes through the tissues, and depending on the condition of the tissues, sometimes this acoustic wave can be a little uncomfortable. Of course, we monitor and change the settings to make it as comfortable as tolerable, but we are trying to get to a certain level on those settings, because that's what the research shows is going to have the best result for you. So it provides pain relief. It upregulates collagen synthesis. Collagen is found in your tendons. It's found in your ligaments. It's found in your cartilage. And so we're basically healing all of those tissues. It promotes new blood vessel formation, which improves the circulation to that area. A lot of people blame their pain on aging, and while aging does play a role, I think it's more likely that it's the decrease in circulation that comes with aging that's actually causing the pain, and so this can reverse that. It reduces inflammation, and it promotes cartilage regeneration, which is why it works so well for labrum tears. It also reduces bone spurs in and around the hip. So really, this is the perfect treatment for somebody with a degenerative hip who has, grade 1 through 3 osteoarthritis in the hip. And so it's awesome that we're able to offer that. So when we're going through the treatment here, we're going to do 8 weekly sessions of shockwave therapy or the rejuvenative therapy. And we're going to do them on these very specific points of the body. These are in the grip approach. These are called the TSI points. I will spend some time finding the exact points that I want to work on with the shockwave, and we'll mark those, and then we'll use the shockwave on those. They're usually in the musculotendinous junction, and you can usually feel, when I find them, you can usually feel the degeneration in that tissue. Some of them are in the joint capsule. Others of them are the actual cartilage itself. And so, based on the evidence, based on the research, there's very specific parameters that we're using, very specific number of shock waves per a second, very specific intensity that we're using, because that's what the research is showing works the best. So we want to give you the best chance to really heal here. So here's some of the research studies. These are just a handful of the research studies that I'm really excited about, that kind of show how effective this non-surgical hip replacement program can be. So first, we're starting with the shockwave therapy. So in the research, this is abbreviated ESWT, so extracorporeal shockwave therapy. It's shown to be more effective than corticosteroid injections and PRP injections for pain reduction. And what I'm really excited about is it promotes stem cell renewal. So it's, not considered stem cell therapy, but it is rejuvenative because it is renewing those stem cells. And it's also accelerating the cartilage healing, which is the whole reason that your hip is, that your radiologist is calling it bone on bone. And if you have the labral tears. So this really makes a huge difference in your recovery. So this is a little bit about the manipulations and the mobilizations that I use on the hip. It's a very comprehensive program for getting the hip moving in all the different ranges. And so this is some of the research that supports basically the manipulations and mobilizations of the hip. So this kind of goes through the different types of force techniques and how that can help. And basically, the manipulations and mobilizations help the hip move better in all the ranges of motion. So it improves that functional movement of the hip. That's really what we're going for. It doesn't really have any negative consequences that this research was able to identify. So, again, going back to some of our shockwave, basically comparing shockwave to cortisone injections. Shockwave pretty much blows cortisone out of the water. I think there probably still is a place for cortisone injections. They're quick acting, but in terms of long-term relief, the shockwave is superior. It also helps with functional gain, so better movement of the hip. There's no cartilage damage. There can be cartilage damage with certain doses of cortisone injections. It lasts for a long time. Anybody who's had a cortisone injection realizes that it doesn't last forever. And then it promotes this stem cell renewal and neovascularization. So it's actually healing the hip. It's getting to the root cause of the problem. It's not just taking the pain away, which is primarily what cortisone does relatively well. So let's look at some of these patient success stories. I had a patient come in a few months back. She had severe chronic hip pain for a couple of years. She had her x-rays. We looked at her x-rays, and her hip osteoarthritis was probably a grade 2, 3. It was right on the edge there. So I was very confident that we would get some great results with her. She loved walking with her husband, couldn't really do that well or for long periods of time, had trouble going up the stairs. And so we did the assessment. We identified the different areas that were going to need the most treatment. And then we started that 8-week program. And she got pretty quick results, I would say, within the first few weeks. She was feeling some significant pain reduction. She was able to walk for longer distances. And she was very diligent. I gave her the global reset strategies. She was doing those at home. She didn't miss any appointments. She was really committed to the program. And after that 8 weeks, her pain had pretty much been gone away completely. She was able to do all the things that she wanted to do. We did do a couple follow-up sessions, not like as part of the program, but just to help her integrate. I gave her some more strengthening exercises for the hip that she could do at home because she was so committed to the program. And, it's only been a few months since I worked on her, but I haven't heard from her. I'm assuming she continues to do really well. So that was just great to see, especially after she'd been through so much and just hadn't really gotten the results that she wanted. So then, this other patient, he's an older man. He does a lot of mentoring in the community, and he used to do a lot of outdoor mentoring. So backpacking trips, hiking trips, kind of botany slash naturalist type of things. And with the hip pain, he couldn't really do those activities like he wanted to, and in his words, he basically tried everything. He'd done PRP injections and cortisone injections and multiple different chiropractors and multiple different physical therapists and multiple massage therapists, and nothing was really helping his hip. He had got some minimal improvement, but felt very discouraged by the whole process. So came in again. He had x-rays of his hip. I looked those over. He had some labs as well. His C-reactive protein, which is a inflammatory marker, was relatively high. So looked at it. He was definitely a grade 3 osteoarthritis. So sometimes with the grade 3, it can take more than the 8-week cycle. Sometimes I have to do another round. That was the case with this patient. After the 8 weeks, we got significant pain reduction, improvement in walking. He was able to return to a lot of the activities that he loved, but we didn't get a full resolution in that 8-week cycle. So he was willing to do another round. We did another round of treatment, and he got back to 100% after that. For him specifically, he was diligent with his at-home exercises, but he needed a lot of help with kind of the diet and lifestyle aspect. That was probably why his CRP was so high as inflammatory markers. And so there was some more support that we had to do in terms of his supplementation, in terms of his diet, to really reduce that inflammation. I mean, the Shockwave by itself is reducing the inflammation in the hip itself. But if there's more systemic inflammation, it's going to take longer for everything to heal. And so I think that is part of the reason we had to do 2 rounds with him, is because there were some other lifestyle modifications that were needing to take place in order for him to get results. So this is the facility here. This is our gym. We've already discussed the Shockwave, which is the primary technology that I use. I'm using straps and bolsters and other things, or goniometers and other things to really measure everything, so I can really track the results that you're getting with the program. But this is a image of the gym where we'll be doing the majority of the treatment here. So let's talk about the protocol itself, so you can make an informed decision about whether this is good for you, would be a good fit for you. So 1 time a week for 8 weeks. Each session is about an hour to an hour and a half long. We're doing the manipulations, the mobilizations, the distraction of the hip. We're doing the global reset strategies, and we're doing shockwave therapy on those muscle tendinous junctions, ligaments, joint capsule, other areas of the hip that's not functioning correctly. The first week, of course, we're doing the comprehensive hip evaluation. After that, I put together a treatment plan for you. It's customized, personalized, specific to you. I really want this to be efficient. So I'm not just giving you all the exercises. I'm giving you very specific exercises based on the assessment and based on what you need in order to improve. Then we're doing all of the hands-on treatment. We're doing the motor control training, and I'm giving you some suggestions on how to reduce your inflammation through nutrition and supplementation. So this is usually what I see with people. Of course, there's variation. Everybody's a little bit different. But usually by that first couple weeks of treatment, you are getting some pain reduction. Then we're getting some mobility improvements in the hip. And you're able to start doing some of the things you weren't able to do prior to coming in. And then by week 8, there's a restoration of full activities, and then I'll give you some additional exercises and home care and other stuff that you can do to maintain all the progress that we've made over that 8-week cycle. And one of the things that it seems important to mention here is that we're doing an hour and a half in the clinic, but really the work that you're doing outside of the clinic, how committed you are to the dietary interventions, to the supplements, and to the global reset strategies really determines your progress. This is we're co-creating this. We're working together as a team. And if you're not doing the work on your own, when I don't see you, it's hard for us to really get these results. So I look for people who are really committed, who really want to get better. If you just want to come in and have somebody do something to you and you're not really interested in doing your home care and doing the things that are going to help you get better, you're probably not a good fit for this program. So ideal candidates, you're currently walking independently, so no walkers. Sometimes canes can be okay, but we want you to be able to walk. A lot of times the canes are used for balance, not specifically because they help so much with pain. Grade 1 through 3 hip arthritis, we've talked about this a bunch. Then you really want to avoid surgery. Some people don't. Some people are completely fine with getting surgery. They don't mind having a synthetic hip. If you want to avoid surgery, then this is good for you. And then what I just touched on earlier, you've got to be committed. You've got to be committed to the process. If you just think you can come in once a week and for an hour and a half and that your hip's going to get better, it's not really realistic. You have to do the home care and be committed to the home care and have a life that allows you to do that. If you're too busy, this might not be the best approach for you because you need to be able to set aside some time to do your homework. It's not suitable for people who have grade 4 arthritis, although I have worked on some people with grade 4 arthritis of the hip. We don't get as good of results as grade 1 through 3. So that's a discussion that I have with them, letting them know that we might not get as good of results, but if they're really committed to not having hip surgery, then this could be their best option. Don't work on people who have any sort of infections or cancer. There's just no way to get results with those people. They need to focus on other aspects of their health. So let's look a little bit about the investment here. So, oftentimes our insurance does cover hip replacement therapy, so it's not a $40,000 to $60,000 out of pocket. But those hip replacement surgeries are expensive, and that cost is definitely being shared by taxpayers. It's being shared by insurance companies. So anything that we can do to reduce that cost, I think that's really important. And then there's a longer recovery time. I mean, of all of the joint replacements, hip is probably the shortest recovery time, but there is recovery time. And then with our 8-week program, the cost is about $5,000 for the entire 8-week program. I do offer some special offers. We use insurance whenever possible. So it's a fraction of the cost, but some of that cost may be out of pocket. And then it also is much quicker. It's an 8-week program. And my favorite part of this, you get to keep your natural hip. You get that organic, natural hip, so that if there's problems down the road, you don't just have to do another replacement. You can work with that organic material. It's a much better scenario, in my opinion. So there are limited appointments available. I only bring a select number of people through this program every couple months. And that's because it takes a lot. It takes a lot for me to design and personalize this treatment and ensure that you're getting the best possible results. And it's, I'm kind of hand holding and helping you through the process. And so I'm only allowing a select number of people to do this program every month. So just to recap one more time, 8-week program, all evaluations are included. Like I said, I'm very systematic. I'm very data driven. I want to measure everything very precisely and see the improvement that we're anticipating. You get the 8 treatment sessions, you get the 8 Shockwave sessions, you get the 8 global reset strategy sessions, you get all the home care, you get nutritional support. So if this is something that you think you would like to do, you can book a 15-minute consult with me. If you have your x-rays, we can go over those x-rays. That would be in person in the office. So you can see the gym, you can see our facility, and you can get a sense of if this is something you want to do. So I offer that 15-minute consult to kind of help you make the decision that's right for you here. So you can book either the initial assessment or the 15-minute consult on my website, drnoahvolz.com. Remember, there is some limited availability. I start this program at the beginning of every month, and so I'll be starting a new session, a new segment with people in the next week. So if you'd like to be a part of that, again, you can schedule online, either booking that initial consult or going ahead and booking your initial assessment. So here's the more contact information. This is my phone number. This is the address of the clinic where I'm working out of. So, you can join the hundreds of patients that I've helped avoid hip surgery. And thank you. Thank you for being interested in this, taking the time to learn about this specific approach. And I just want to mention that currently I'm only doing a non-surgical hip replacement program, but non-surgical shoulder and knee replacement program are in the works. And so if that's something that you would be interested in or know somebody who would be interested in, you can reach out, get on the waiting list. And as soon as we launch those programs, we'll be in touch with you and let you know about those programs as well. Thank you again for attending. I hope that this was beneficial. I hope that you have a clear understanding on what non-surgical hip replacement is, how it works, the results that you can expect from that. And if you have any questions, you've got all my contact information there. So feel free to reach out to me and the team. And yeah, if this is something that's right for you, I really look forward to working with you.